Let me tell you about mouth ulcers. You have three main type of mouth ulcers: minor aphthous ulcer, major aphthous ulcer, and herpetic mouth ulcers. In this, the most common being minor aphthous ulcer. Other than this, at least 40 to 50 diseases I can mention, which can manifest as, one of the manifestations will be oral cavity or mouth ulcers. And these conditions, you have so many other manifestations also. So in this video, I'll talk mainly about minor aphthous ulcer. Here, the patient will present with multiple oral cavity ulcers, and each ulcer will be less than 10 millimeter. That will be average of 2 to 3 millimeters. They'll have a center white in color, surrounded by red halo, and it will be painful. This is more commonly seen above the age group of 15, between the age group of 15 to 40. Now, it is seen, if you talk about gender, it is more common in males, more common in professionals, and especially in type A personality. So when I talk about personality disorder, you have at least 16 types of personality disorder, the common ones being 5 types. In that, type A personality means that person is always stressed up. He takes up a lot of responsibilities, but none of the responsibilities he is able to fulfill. He is always overthinking about the job. This type of personality, they come under type A personality disorder. So these type of people, like professionals and type A personality disorders, they have more chances of getting minor aphthous ulcer. So what is the cause for this? There is no specific cause being identified for this minor aphthous ulcer. It has been proposed that maybe this is autoimmune related. So what do you mean by autoimmune disease? See, every one of us, we have immune system or body protective mechanism system in our body. If there is any external factors like fungus, bacteria, virus, or any other disease which is trying to enter our body, our protective mechanism or the immune system, it becomes activated, it fights against the external factors, and it completely destroys that. In autoimmune condition, what happens is, without any outside triggering factor, our own body protective mechanism, it gets activated. And it targets any one of our body parts, and it slowly destroys that. So in this minor aphthous ulcer condition, what happens is that targeting part is the soft oral cavity mucosa, and it results in multiple ulcers. This is what I mean by stress-induced autoimmune condition, which is minor aphthous ulcer. So what are the predisposing factors? Which means all these, the predisposing factor, it is not a cause for minor aphthous ulcer, but these are predisposing factor where if they have, there is more chances of getting it, and it prolongs the duration too. If you take a history of the patient who is suffering from minor aphthous ulcer, they'll tell you that their parents have the same problem. So the high possibility it can go to the next generation also. Like how I mentioned before, the type A personality or those who are really stressed up, they have high chances of getting it. Especially so if they have anxiety disorder. Now, some of them, they may have gastrointestinal disorders like stomach problem, gastroesophageal reflux disease, or any disease which is related to the small intestine. They may also have, same time they may have minor aphthous ulcer also. Not only that, if there is sleep deprivation which is indirectly connected to the stress, that also can predispose to minor aphthous ulcer. And in ladies, if there is a wide variation of hormonal variation, that can also induce minor aphthous ulcer. Now, coming to the complaint. Most of the patient, what they complain is, they have pain in the oral cavity and they are not able to eat properly, and if suppose it is severe, they will not be able to talk properly. So when we examine what is the reason for this, we find multiple ulcers in the oral cavity, like how I mentioned before. You have so many involving the lips, tongue, buccal mucosa, and each ulcer will be average of 2 to 3 millimeters but less than 10 millimeters. Center white in color, as you see in this photograph, surrounded by red halo. It will be painful. Because of the pain, he is not able to eat properly. When you ask them, is there a family history? The answer is going to be yes. And when you check out the personality, he will be type A personality. So we have a diagnosis. For this, we don't need any investigation. This is a clinical diagnosis. From the history and examination, we can very well make out. There is no specific investigation for this. Now, coming to the treatment. So, before that, let me tell you about the prognosis. When the person or the patient suffers from minor aphthous ulcer, it usually resolves by 7 to 14 days, 7 to 10 days maybe. And once it heals, it doesn't leave any scar at all. So before I start the treatment, I tell my patients that if you treat, it will resolve by 7 days. If I leave it alone, it will resolve by 1 week, which is the same. That means it's a condition where it fades off within 7 days, in a week's period. In that case, what is the importance of this video? What is the importance of the treatment? So this is only to give you small hints to make your life little comfortable during this 7 days period. There is no specific medication to treat this condition. This is only to make you comfortable in that 7 days to 10 days period and not to aggravate it. Now, most of these patients, they have a habit of keep on touching the ulcer with their tongue, keep on irritating the ulcer, which is very bad. That's the first thing to be stopped. Now, the diet. What was the main complaint of the patient? They say they are not able to eat because of the pain. So, the diet, lifestyle modification, the diet has to be changed. It has to be soft diet and more of liquid diet. Soft diet in the sense, no hard things to be taken. No non-veg as far as possible, especially fried ones. And like mutton, chicken, fish fry, all that hard stuff. It has to be soft and more of liquid. In such a way, when that particular diet, what meal you're taking, when it comes in contact with the ulcer, it should not be painful. That's the idea. So what happens when you take a hard diet, hard food, it comes in contact with the ulcer and it irritates the ulcer and it prolongs healing period. So since it is painful, usually when you take food, you will try to reduce the pain by yourself. But if you take liquid food, it will not be painful. So you are giving a natural resolution time to the ulcer. So what is the importance of this video? Now, this pain and discomfort, it is going to stay for at least 7 days. So I'll tell you at least 15 or 20 remedies, which is going to help you in this 7 or 10 days. And most of it is, these are not medications, it's all home remedies. So all these remedies which I am going to tell you, it has to be done after taking your meals, whether after breakfast or after lunch or dinner. So let me start with the first one. You can apply honey over the ulcers, or you can make a paste of baking soda. Either make a paste and apply over the ulcer, or in 1 glass of water, add up half teaspoon of baking soda and you can gargle twice or thrice daily. The third one being about honey and baking soda I have told you. Third one is simple coconut oil to be applied over the area. Here you don't have to gargle. Apply 3 or 4 times per day over the ulcer and just leave it like that. So whenever you do this, once you apply, you leave it for 2 to 3 hours. try to avoid taking any fluid or taking any food after that, so that that medication stays there for some time. There's a remedy stays there for some time. Now the fourth one, the simple solution is at home you can prepare saline solution or salt water gargle, where you prepare with 1 glass of water, you add a 1 tablespoon of salt, non-iodized salt. It can be Himalayan salt, or it can be pink salt, it can be rock salt, but non-iodized. Why I am saying non-iodized? Because iodized salt, it may irritate the ulcer. That's why. If you don't have any of this option, you have only iodized salt, even that you can do it. Even with that you can do it. So you gargle 3 or 4 times per day. Now, clove oil, you apply in a cotton and you apply over the ulcers. You put it on the cotton and apply over the ulcers and leave it like that for 2 to 3 hours. The very fast way of relieving pain is applying ice cubes over the ulcer. The problem is it relieves very fast. The pain is relieved very fast, but it lasts only for 20 minutes. Very short duration. Now, coconut oil application I have told you. Likewise, you can gargle with coconut milk also, which you have to do 2 or 3 times daily. Next option is you can prepare turmeric paste, or in 1 glass of water with less than half teaspoon turmeric powder in it, in warm water, you can gargle 2 or 3 times daily. It's better to have 1 glass of orange juice for the next 7 days. See, all these remedies which I am telling you doesn't mean you take all. What I mean is you choose any one of these which is suitable for you. The next one, like how you have prepared baking soda paste, likewise you can prepare alum powder too, and you apply over that particular area, leave it for 5-10 minutes and gargle with normal water. This you can do at least 2 times daily. Next will be taking yogurt, 1 tablespoon of yogurt every day after meals. Next one is cabbage. A raw cabbage, make a paste, and that paste can be applied over the ulcer, or make a juice with which you can do gargling, or even you can bring the raw cabbage juice too. That is also going to help you. Now, apple cider vinegar or hydrogen peroxide, this has to be diluted 1:1, and you can do mouth gargle at least 2 or 3 times daily. In this, apple cider vinegar is really helpful. Now, same way, aloe vera juice also. Like how you have prepared turmeric paste, likewise you can prepare garlic paste. See, all this turmeric and garlic paste, these are all Indian products which is easily available in the market. But these ones which you're going to apply, we have to make it at home. Why I am saying so is because the one which is available, it is to make curry. It has got ingredients in that which is not suitable for these conditions. You have to prepare one at home. So even this garlic paste application is good. Likewise, you get milk of magnesium, which is thick milk, white in color, which has to apply over this ulcer. It stays in contact with the ulcer, say for about 10 or 15 minutes, then you can gargle and spit it out. Last one is simple tulsi leaves. It is very helpful. You can take 2 or 3 tulsi leaves every day for next 7 days. Now, these are all home remedies. Now, coming to commercially available medications. So, when you have a diagnosis of minor aphthous ulcer and you visit any of the doctors, most of them, they prescribe a multivitamin tablet or B complex. If so, it's better you take a B complex which contains zinc also. Now, coming to the local application, there are so many available in the market. So, these ones are local anesthetic agents which you apply, it anesthetizes the whole area, which are really very effective. You apply within the next 10 minutes, that whole area, you will not feel the pain at all. So it is effective, it is really effective. Can I have normal food after that? Yes, you can. Then what is the problem? Then this has to be the best one. See, usually what I do is I don't advise this as a first option because the ulcer, how did I start the treatment of ulcer? I said don't mingle with the ulcer with your tongue. Don't keep on irritating the ulcer. So what happens is when you apply any of these and you take your lunch normally and you like to prefer to take hard foods as usual, it comes in contact with the ulcer and you don't feel the pain at all because you have applied the medication. It irritates the ulcer a lot and it prolongs the healing period. So usually I reserve these drugs for those professionals who have muffled voice and very stressed up, but they are not able to talk even properly. So they have to attend a meeting. They have so many lectures to be given. Have to manage so many of them. If those people, if I tell them, just take it at that particular moment and not every day, because you give the time rest to that part, to the ulcer part, so that it heals by itself. Usually, if you leave it like that and take soft diet, 7 days to 10 days is more than enough. If you irritate the part, the ulcers, it will stay longer and it will heal only by 14 days. Now, coming to hydrocortisone or steroid lozenges, that you can apply directly over the ulcer, which is effective. Likewise, you buy a tablet of steroid, omnocotil, 10 milligrams, or 20 milligram tablet in 10 ml of water. But before adding, you powder the whole tablet properly and mix it with warm water and filter, and with that water you gargle. But please bear in mind, don't take it inside. These are steroids, strong medication with so many side effects. This is only for local action. That's all. This is about medications, which is you will get it over the counter from the pharmacy. Now, what are the things to be avoided? I've given a long list about 20 medications, 20 home remedies. Now, what are the things to avoid? Anything which doesn't irritate your ulcer, you can take it. So, these are the things which irritates the ulcer. Any spicy food, any hot drinks, even chocolate can, coffee can, then coffee, chocolate, and especially citrus juice like lemon juice and pineapple. So try to avoid all this. And about non-veg, I have already mentioned. About fried foods, I have already mentioned. You have to avoid. You're a smoker, please quit smoking. Stop smoking. And drink a lot of water. Plenty of water. Now, there should be a good care of oral dentition too. The paste which you are using, it has to be mild so that it doesn't irritate the ulcer. Likewise, normally you are supposed to change your brush every 3 months. See, that brush which you buy, it comes, the bristles, it comes as soft, medium size and hard one. Maybe you have a soft one. But even that, when you use it for more than 3 months, it becomes hard. So it's better that you keep on changing the toothbrush every 3 months. So I have mentioned in detail about minor aphthous ulcer. What is the cause for it? How does the patient present? There is no specific treatment for it. For this, I have mentioned so many home remedies to make your life comfortable for that 7 days, which is a healing period. If you follow any one of this, it will be better for you. Most important part is don't eat anything which irritates your ulcer, and don't keep on touching the ulcer with your tongue. These are the main things to be followed. Thank you so much.